Joining us is Teddy Kaberuka, an economic analyst who has been closely following the trend of how much COVID-19 is affecting the continent and the world in general. He will share with us the effects of this crisis, the trade, economy, and employment, and anything else that is happening as a result of COVID-19. And after his presentation, we'll be asking questions, providing our comments. And for the sake of this technology, we will again try to use the chat icon.
This disease came at the time where no one would expect it to be to that big magnitudes. It started in China back in November, where the first case was seen. From a public health perspective, actually epidemics have phases. We have 5 phases. Phase 1, where we have no case. Phase 2, where there is early stage of outbreak. So in that case, there are very few cases and all the cases are imported. Those imported cases start to contaminate the local cases. And then phase 3, we have advanced outbreak where even the locals who contracted the disease start to spread it all over. And then phase 4, which is a large outbreak. And some of the big countries like the US, like Italy, like Portugal, they have reached the phase 4 where things are really worse. The first one is preparedness for the COVID. So the moment a country understands that a disease is outbreaking, country should have a response for it. After that, it should have a prevention transmission plan so that in case it happened to that country, then the country respond to it properly. So within all these response measures, that's where we find like coordination of the disease from the government perspective. We find the surveillance, we find the laboratory, the clinical management. All those are measures to control the spread, because what is worse is if there's no control of the spread, all the humanity can be eradicated, because this is a very dangerous disease. We have 6 countries in the East African community, and countries on different phases. If I can refer to one of the countries like South Sudan, where they report 0 case, they are not yet in the epidemiological phase, but they should be at phase 0, where they don't have any case, but they should be ready in case something happen. When I say to be ready, they should be prepare all the logistics. Just in case something happen, what will they do? If people are entering in the country, do they have the laboratory necessary testing kits to do it? Do they have all the material for the medical staff to protect themselves? Because if they are at risk, then they can even spread the disease much faster. Do they have the clinical management mechanism? Do they have enough beds? Do they have clinics? Do they have health personnel? All those are like all the logistics needed to be prepared for disease. However, in other countries, countries like Kenya and Rwanda with a high number of positive cases, we are at the phase 2, where the disease is now expanding. We are moving from imported cases to now local contamination, which is very critical. So that's why actually government need to take serious measures. A country like Rwanda took total lockdown. It means all the borders closed, people are kept at home, no movement of people. They are asking people to do social distancing. People should avoid a close contact, because the disease is transmitted through contacts. Some public health measures were recommended, actually are reinforced, like cleaning hands with soaps, wearing face masks when people go out, availing cleaning and the disinfectants everywhere where you go, you see it, and then the community education, so that people know how the disease is transmitted and they can avoid it. Stopping in the international flight has an effect, a very tremendous effect on aviation sector. Just understand the airplane company, the airport services, and all the related service. You know how many people are employed in that sector. The other sector which was affected from the beginning was the hospitality industry. Hotels, restaurants, and bars and everything. Because the hospitality industry was receiving tourists, even international traveler, so they were the first one to be hit by the effect of disease. If we look from the human perspective, if the hospitality industry was employing, let's say, 20,000 people, then they were forced to downsize their staff. Actually, we saw so many hotels suspending contract of their employees or putting some employees on the technical holidays. But it was at the beginning, but now things went worse. We saw the tourism sector going down, no more gorilla tracking, no more safari tracking, because even countries were scared that tourists, even those few ones who can come, they can contaminate our animals, and they have another effect on the tourism in the future. So it was a decision taken. Another sector which was is still paralyzed is the transport sector. We know how our transport system is interconnecting, being the big cities to the rural area, being cross cities like Kigali, Kampala, Nairobi, Dar es Salaam. We know how it was very much affected. Just reflect to the borders, being Kampala, being Rwanda, in the whole region, border was one of the big sector employing a big number of people and then offering service to the people. So I just highlighted some of the critical sector which were affected at the beginning, even now, but the effect goes beyond particular sectors, because if I look at it from a macroeconomic perspective, like government sides and all the economic sector, now it's an emergency state of situation. Government are not working on their normal businesses. And the top of the priority is COVID. They need to control, they need to spend money. All the money government is spending now was never planned in any of the budget. If I was reviewing the budget of East African countries, there was no single coins for this COVID, because we know it was not known even 7 months ago. So there was no plan for it. Therefore, there is what we call diversion of the budget. So government is taking money from other budget line to be injected to the health sector so that they can control the disease. It means there is an opportunity cost for the government using the money for the health, and other sector will be suffering. So it means there won't be any additional investment in this period, which will affect in the future the productivity of the government. If you go to the individual level, if people are confined, grounded in their homes, they are not working, it means, first of all, for those who manage to have some savings, instead of using the saving for investment, and now they are consuming the investment. It means in the future we'll have a slowdown of investment at the individual level. So it is creating another economic loss, a very big economic loss, going from individual to the enterprises, to the government, to the society at large, because on the side of government won't get the same tax it was expecting, because people didn't work. We saw some government having some initiative, like expanding or extending the deadline to pay tax. This happened in Rwanda for the corporate tax. It was due on 30th March, but it was extended. There are some initiative of government, like Kenyan government, so to facilitate taxpayers and companies losing their turnover, so that they can keep still their staff. But in general, it is affecting companies, private sector, and people at large. Our countries has been exporting agriculture commodities. You know, I can refer even to some of the countries. We know how much Rwanda export in coffee, in tea, you know, in flowers, in horticulture. Same in Kenya. Kenya was the second exporter of flowers to the European Union. The global market is almost closed. People are grounded in their homes, so it means the Kenyan market will fall a lot because they are losing money. They were at the harvesting time and exporting their flowers, but now they can't because the market is not working. Same to Rwanda. Another element, we know that our economies, being Kenya, being Tanzania, being Uganda, we all have a deficit budget. Our own revenues can't finance our expenses. It means all the countries would borrow money to get the top up, either borrowing or getting donation from the international community, being countries or international organizations. So I'm sure the situation will even go worse. We will see so many countries having a very huge deficit and go to borrow more money to the international organization. Like what happened yesterday, you saw the announcement from the IMF giving loan to Rwanda of more than 100 million of US dollars to support, to manage the COVID-19 crisis. So we will see so many other countries doing the same in the near future. Especially, I expect a country like Uganda doing the same, because I know they have a very serious financial deficits. The only risk as an analyst I see is the corruption situation in some countries, because when you see a human crisis like this, there is always a corruption risk behind, because if country would start to get additional loans and the donation, the risk associated to corruption is also high. Remember some of the projects which started in some of the countries, and those projects never ended because money was diverted to people's accounts and pockets. Something very important related to the disease and the regional integration. You know, the whole purpose of regional integration is movement of people and goods. And now we are facing a contradicting situation where the disease requires people to stay home. So if the integration was a movement of people and goods, and now the disease requires people to be grounded, it means the moment the situation will get back to the normal, the movement of people will be reduced. Actually, even countries will put some mechanism to control another outbreak of the disease, which means as an East African community region, there is a need to put in place a very good screening mechanism at the borders of different countries. There should be a laboratory equipment at the border so that if I cross a country, for them to protect themselves, they can test me. If I'm okay, then I continue my journey. If there is a problem, then I get treatment at the East African border. So those public health mechanisms need to be coordinated, harmonized at the different border posts of the countries so that the regional integration would be effective. Otherwise, some countries will totally decide to close their borders, and it will create again a backslide to the economic integration of the countries. I think I tried to navigate all the aspect of the COVID and the economic integration. I can give the floor back to the moderator so that we can proceed with questions. Thank you so much.
Thank you very much, Eddie. Such a thoughtful presentation. A number of good questions that have been asked by our participants.